Bismillahirrahmanirrahim. We have started the series of online lectures, and today we will start with the first chapter of the journal Pathology for third year M.B.B.S students. In today's lecture, we will make an introduction to pathology, and then we will discuss various cellular adaptations to stress and noxious stimuli. Now, before we go to discuss cellular adaptations, first we make an introduction to the pathology. In your first year and second year, you have studied the physiology, anatomy, and biochemistry. And physiology is the normal function of the body tissues, anatomy is the structure of the body tissues, and here we come to the abnormalities that we study in pathology. Patho means suffering or disease, and the logos is from the study. So pathology is the study of disease. Now, what basically we study in pathology? Two things. Remember two important things. The number one is the etiology, which describes the underlying causes and certain modifying factors of a disease and its consequences. And by this we mean why a disease occurs, why a tissue become diseased. Here are two important things that I want to discuss. That most common diseases, for example, hypertension, diabetes, and others, they are the result of two things: genetic susceptibility and the environmental factors. By genetic susceptibility, I mean that we have got two persons, right? Now, one person here out of the two will develop disease and the other will not. Do both the persons have the same environmental factors? So we say that the person who developed the disease is having genetic susceptibility. He is genetically susceptible to the disease. And the second thing that accounts for a disease are the environmental factors. So any disease, most of the diseases, they are the result of these two components, and they should be considered while we study the diseases. Some people are genetically susceptible to particular diseases. Therefore, we say that some diseases, they run in families, while environmental factors play important role in the etiology and pathogenesis of the disease. For example, in our today life, the sedentary lifestyle that we have adopted, and there is a lack of exercise and other activities. Mental work is more than the physical work. So what happens that we consume lot of calories and burn very little. So where it will go? Persons, they will become obese and overweight. And as you know that the obesity is a risk factor for diabetes, hypertension, and other diseases. So these are the environmental factors. So finally, coming to the disease, these two things, the genetic susceptibility and the environmental factors, they are equally important. Because as I said, that if we have got two persons and both of them have the same environment, but one developed disease and the others do not, so we say that the person who developed the disease, he is genetically susceptible to that particular disease. So in pathology, first we study the etiology, how a disease occurs, and here the question is why. Now, the second thing that we study in pathology is the pathogenesis. Pathogenesis is the process, stepwise process, that how a disease develops in a tissue. And here we ask how the disease develops in a tissue. So there are so many factors involved in the pathogenesis, and there are variations from disease to disease. But by defining the etiology and pathogenesis of the disease in pathology, we come to the point that we understand a disease. Right? Now, once we understand the disease, and we provide a diagnosis from our pathology, then at this diagnosis and this understanding of the etiology and pathogenesis of the disease then provides basis for developing rational treatments, and therefore we say that pathology is the basis of medicine. A student who doesn't know pathology is not expected to understand medicine and even surgery. We divide pathology into two branches. The general pathology, which describes the cellular and tissue alterations caused by the pathologic stimuli in all body tissues, in most body tissues. So this is general. And in systemic pathology or spatial pathology, we describe the pathologic reactions and abnormalities of different specialized organs. Organs, they differ from each other in their function, in their structure, and their cellular content, and so many other things. So, coming to the summary, in first year and second year, we study the basic sciences of physiology, anatomy, and biochemistry. So we study the normal, a healthy normal person. But once the person becomes diseased, then from here starts the pathology. And in pathology, we make study of the diseases. Now, how do we study the etiology and how do we study the pathogenesis? We use in pathology various techniques, right? So these techniques may be morphologic by examining the gross and microscopic structures of the diseased tissues. We use certain immunologic techniques, for example, serological tests, in which antigen antibody reactions occur, and we use these serological tests for the diagnosis of many diseases, particularly bacterial and viral diseases. And the immunologic technique is not the final. We have to confirm the disease by using other methods. And this is a combination of various investigations that we come to the diagnosis. And we also use certain microbiologic techniques, particularly when we are dealing with infections. In that situation, we use so many tests, for example, gram staining, for example, ZN staining, and other microbiologic tests to identify organisms and to study the pathogenesis of the disease. Now, when we study the etiology and the pathogenesis of the disease, and to study the morphology, which is the gross and microscopic changes caused by a disease in different body tissues and organs, we say we can explain that how these changes give rise to the clinical manifestations known as signs and symptoms. We in pathology explain that why a symptom occur in a patient, why there is a sign. So we study the background and the etiology and pathogenesis of various changes that occur in the body tissues in diseased conditions, and how do they give rise to various signs symptoms. So in pathology, we make diagnosis. We diagnose a disease by using morphologic, immunologic, and microbiologic techniques. Once we have diagnosed the disease, now the medicine, here comes the role of the medicine, and the medicine and pathology are so integrated and combined that it is the pathology which will guide the therapy by the physician. Now, before going to the abnormal cell, here we make a brief review of the normal human cell. You know that the human cell are the building blocks of our tissues, and each cell is enclosed in a cell membrane, which is a lipid phospholipid bilayer, and inside the cell there is cytoplasm and nucleus. The nucleus is enclosed in a membrane which is the nuclear membrane, and the nucleus, which is the brain of the cell. All the functions are regulated mostly from the nucleus of the cell. Now, coming outside the nucleus, there are Golgi apparatus, ribosomes, and endoplasmic reticulum. The ribosomes, these are the sites where various proteins, structural or functional proteins, they are synthesized. And this synthesis is controlled from the nucleus. This is the nucleus that will order the ribosomes through the messenger RNA, which is translated from the DNA, and which will go outside the DNA into the cytoplasm and in the ribosomes, and in combination with the ribosomal RNA and transfer RNA, it will guide the synthesis of various proteins needed by the cell. The cytoplasm is a gel-like fluid which is around the nucleus, and it contains the endoplasmic reticulum, where proteins are processed and then they are stored in Golgi apparatus, and when needed they are released. The cytoplasm also contains lysosomes, which are vacuoles that contain various enzymes, for example hydrolytic enzymes, hydrolysis, proteases, and uh, things other, and they are involved in phagocytosis, which is done by the cells by forming phagolysosomes that we will study next. The centrioles present in the cell cytoplasm, they are involved in cell divisions, particularly the mitotic cell divisions. Now, what we are supposed to study in cell injury? We will study cellular adaptations to stress, right? Then we study the causes of cell injury, how a cell injury is caused, what are the triggers that cause cell injury, and then once cell injury has been caused by the an etiological agent, then we study the disease cell and tissue injury by studying its morphology, that is the gross appearance and microscopic appearance. And we will study the mechanisms that lead to cell injury, and we will study some examples of cell injury, and we will also study in this chapter some abnormal intracellular accumulations that give rise to various pathological conditions. Normally, the cell remains in a state of homeostasis. By homeostasis means that the environment provided to the cell is within defined physiological parameters. As we can tolerate heat up to a certain limit, we can tolerate heat cool up to a certain limit. So the same is true about the normal cell. It has got physiological limits, but once if this cell is stressed, so the first thing that the cell will do is that it will adapt itself according to the new environment. And now we say that this is an adapted cell, and this cellular adaptation is very important for the survival and living of the living cells. Right? Now, sometimes the body cells that we divide on their ability to adopt, some cells can adopt themselves while others cannot, and for this purpose we divide the body cells into labile cells, permanent cells, and stable cells that we study in the next slide. But if the cell is unable to adopt, right, or the stimulus is severe, then what happens? The cell injury occurs. Cell will become injured. But if this injury is mild, transient, and if it is removed, if it doesn't persist for longer periods, the cell will return to its original normal state, and we say this is reversible injury. But the reversibility of the cell injury mm, is dependent on the etiological factor, that how strong is it, and it also depends on the immune state and health of the person. But if the cell, the etiological agent is progressive, if it is strong, if the body tissue doesn't have the ability to adapt, then it will lead to irreversible injury. And once the cells are irreversibly injured, they will die. And cell death in pathology is defined by two types of cell death. One is the necrotic cell death. By necrotic cell death, we mean that the cell death is induced on the cell. The other type of cell death is the apoptic cell death, and apoptic cell death here differs from the necrotic cell death, that necrotic cell death is always pathological, while apoptic cell death may be physiological or pathological. And pathological cell death, which is known as the programmed programmed suicidal cell death, may occur in pathological, but there are certain pathological conditions, particularly during embryogenesis, and so many other conditions that we will discuss when we study the apoptic cell death. So necrotic cell death is always pathological, while the apoptic cell death may be physiological or it may be pathological. Now we take the example of the heart, myocardium, that when it is stressed, how it undergoes the changes. For example, suppose that if the heart is exposed to hypertension, high blood pressure, or if there is a narrowed stenotic valve, automatically the heart will do more stronger function to compensate for these two conditions, and this will lead to the increased load on the myocardium. So what happens here, that the according to the new environment that is induced by hypertension and or stenotic heart valve, it will induce more functional and powerful uh, heart contractions, and it will increase the demand on the heart. So the myocardium, the heart will undergo adaptation, and it will undergo hypertrophy to compensate for the increased demand to maintain the life. So it will undergo adaptation in the form of hypertrophy. Now if the load is relieved or removed, we can expect that the heart will return to its normal size and its normal function. But if the load is not relieved, or if the heart is not getting enough coronary blood supply to compensate for the increased function, what will happen, that then the heart will become injured. For example, in an ischemic heart with low coronary blood supply, the heart will be unable to maintain hypertrophy. So if the stress is mild and if it is removed, it will be a form of reversible cell injury, right? But if the stress is severe, if it is persistent, so it will lead to irreversible cell injury, and that will be in the form of myocardial infarction or ischemic cell death. Now coming to the adaptations, what is an adaptation? Adaptation is a reversible change. Reversible change, remember, it is a reversible change, and it is the capability of the cell to adapt itself to a new steady state to compensate for the new environment. Normally, when we say homeostasis, by homeostasis we mean that the intracellular environment is kept within a defined range of physiologic parameters. By that we mean that we cannot increase the concentration of certain cellular constituents indefinitely. The cell will tolerate a decrease or increase up to a certain limits, but after that it will become damaged. So but in homeostasis, when all the physiological parameters are within the defined range, we say that the cell is normal and it is in a normal steady state. But under the conditions of certain physiologic stimuli, for example, if the demand is increased, as we said, uh, uh, in different physiological conditions, the demand from the tissues and from the cell is increased, or if there is some pathologic stress, what will happen? Now the cell, it will adopt itself and it will readjust its structure and function. So this readjustment will lead the cell to an adapted cell, and the adapted cell is now lying in a new steady state, and this is a way to preserve life and function by a cell. Adaptations are reversible cellular responses to stress. They are reversible, remember. Now, there are certain types of adaptations. Uh, for example, if there is increased or decreased stimulation in the form of hormones or other trophic factors, or increased or decreased supply of the nutrients, what will happen? That the cell, if it is stimulated or if the demand is increased, for example, in thyroid gland, if there is a deficiency of thyroid hormones, now the TSH that comes from the anterior pituitary, it will continually stimulate the thyroid cells, and the thyroid cells will undergo hypertrophy and hyperplasia. So sorry, when the cells are stimulated, when the demand is increased, the cells, they undergo hypertrophy and hyperplasia. By hypertrophy we mean that the increase in the size of the organ occurs due to increase in the size of its individual cells, while in hyperplasia the increase is because of increase in the number of cells, and hypertrophy and hyperplasia sometimes occur together. Now, if the tissue is deprived of its nutrition and nutrient supply, or if it is deprived of the stimulation by the trophic factors or by hormones, now what will happen? It will undergo atrophy. That will be decreased in the size of the tissue. Right? Sometimes chronic irritation in the form of physical or chemical stimuli, they stimulate the cell to undergo metaplasia. By metaplasia we mean that one type of adult epithelium is changed into another type of adult epithelium. For example, in smokers, normally the airways, they are lined by the columnar epithelial cells. The columnar epithelial cells, they are very beneficial. They have cilia and they secrete mucus and keep the airways clean. But comparatively, when they are compared with the squamous cells, they are less able to withstand harsh environments. So now to remain live and for the survival, the cells of a person who is a heavy smoker and whose respiratory tract is exposed to various toxins in the smoke, what will happen? That the respiratory epithelium, it will undergo metaplasia, in which the adult columnar epithelial epithelium is replaced by the stratified squamous epithelium. The stratified squamous epithelial cells are comparatively stronger than columnar epithelial cells. They can withstand the harsh environment better as compared to columnar epithelial cells, but they are not so much beneficial. And moreover, metaplasia also provides a fertile field for the development of cancer. Now, adaptations, uh, these are, as I said, uh, reversible changes, and the stimuli for adaptations are the changes in the environment in the form of increased stimulation or demand, or sometimes when the blood flow, the arterial supply, uh, and venous drainage from a tissue is damaged and stressed, and if the a tissue is deprived of its nutritional supply, what will happen? The cell will undergo adaptation. Now this adaptation will be either in the number of cells, increased or decreased in the number, hyperplasia and hypertrophy. Uh, it will be in the size of the cells and tissues, uh, like atrophy and hypertrophy. It will be in the phenotype. For example, the cells, they undergo metaplasia, and there are changes in the metabolic activity, and ultimately all these adaptations will lead to changes in the functions of the cells. So adaptations may occur physiologically, or they may be pathologic. In physiologic adaptations, the response, they it is physiological, not pathological, and it is mostly in the form of hormones and endogenous chemical mediators. For example, during pregnancy, hypertrophy and hyperplasia of the breast occurs, but this is physiologic. Similarly, there is hyperplasia and hypertrophy of the female uterus, but this is also physiologic. But sometimes the adaptation may be caused by a pathologic stimulus. For example, as I said, that if the uh, thyroid gland is stimulated by abnormally excessive secretion of the TSH, thyroid stimulating hormone, from the anterior pituitary, so this may lead to pathologic conditions in the form of hyperthyroidism or hypothyroidism. So, the purpose of pathologic adaptation is to that the cell try to remain survive and to escape the injury. Now, as I said, that adaptations are reversible changes, and the cell can return to its original shape if the cause is removed. Now, when the size of the cell is increased, this type of adaptation is known as the hypertrophy. When the size of the cell is decreased and the size of the tissue is decreased, this type of adaptation is known as the atrophy. And if there is an increase in the number of cells in a tissue, we say this adaptation is the hyperplasia. And if there is a change in the shape of the cell, as I said, in metaplasia, in which one adult type of epithelium is replaced by another type of adult epithelium, this is metaplasia. But remember that adaptation is also limited. There are limitations to the adaptation. It is not an indefinite thing uh, anywhere. And in severe stress, if the adaptive capability of the cell is exceeded, automatically it will lead to cell injury. Now we divide the body cells, various cells in the body, into three types. One type of cells, they are known as the labile cells, and the labile cells, they throughout life they are lost and replaced by newly forming cells. They proliferate throughout life, replacing the dead and lost cells, and at the end maintaining a normal cell population. A simple example is that of the red blood cells. You know that the red blood cells, they have got a life of 120 days, and after 120 days these red blood cells die and are removed by the spleen and other reticuloendothelial organs, but at the same time the bone marrow supply new red blood cells, and we have a constant number and supply of the red blood cells. The similar is true about the various cells that line the gastrointestinal tract, the cells that line the skin. They continually shed and are replaced by new cells. Now these, the new cells, they are derived either from the proliferation of the existing mature cells, but the capability of the cells to divide, it also decreases with time. And in the most of the tissues there are cells known as the stem cells, and these stem cells then start proliferation and supply a fresh supply of the new cells. So these are the labile cells, and the labile cells, they, the tissues that are made of labile cells, they have greater ability to regenerate themselves. The second type of cells are the stable cells. The stable cells are those cells, particularly the glandular epithelial cells, that remain quiescent. They do not divide. They do not undergo mitotic division normally, but if they are stimulated by certain hormones and certain trophic factors, and when there is an increased function is needed and when there is a demand, they are capable of undergoing cellular divisions and regeneration. So the stable cells, they occur, they proliferate and regenerate themselves only when it is needed. The third type of cells are known as the permanent cells, and unfortunately the permanent cells, they have no proliferative capability in the postnatal life. By that, what I mean, that once a baby is born and his certain body tissues are developed, then there is no chance that the tissues will become injured and they will be regenerated or resolved. So particularly we will talk about the nerve cells, neurons, and the skeletal muscle cells, and certain other cells in the body are such that we get them once in life. Once they are damaged, they cannot be replaced. Now hypertrophy is the increase in the size of the cell, individual cells, and collectively they will make an increase in the size of the tissue and organ. And hypertrophy is caused when there is increased functional demand. For example, in athletes and people, they do exercise, they get stronger muscles, and this increase in the muscle is due to increase in the individual skeletal muscle cells, because the skeletal muscle cells have got a very little capability to divide. In addition, when there is hormonal stimulation, as for example occur during pregnancy, the estrogen and progesterone, they stimulate the uterus, and the normal uterus increase in size. And here in this situation, the uterine cells, they undergo hypertrophy as well as hyperplasia. So how hypertrophy occurs? Certain signals and hormones, they have got their receptors in the cells. These receptors may be in the cell membrane or in the cytoplasm, and sometimes in the nucleus. So once the receptor lesion interaction occurs, the nucleus of the cell orders the ribosomes for the synthesis of more and more structural proteins and certain growth factors, and they will, the increased synthesis of proteins, structural and functional proteins, will cause an increase in the size of the cell, and we say this is hypertrophy. Now hypertrophy may be physiological or it may be pathological. Now by coming to the examples of hypertrophy, the skeletal muscle cells hypertrophy in athletes, which is induced by exercise, it is physiological. Similarly, the endometrial hyperplasia and hypertrophy in a menstruating female normally and during pregnancy, it is physiological. However, if the hormonal balance is disrupted in some diseases of the female genital tract, then the endometrial hyperplasia and hypertrophy, it will be abnormal, and endometrial hyperplasia is a fertile field for the development of the cancer. So here we can say that hypertrophy may be physiological or it may be pathological. The Coming to the pathological hypertrophy, we have seen that in hypertension, when the uh, heart uh, gets resistant to push the blood in the blood vessels, and if aortic valve becomes stenosed, it becomes narrow. So here in this situation, it becomes difficult for the heart to push blood through it, and in this case, the hypertrophy that occurs in the heart, it is purely pathological. In this slide, we can see the normal small uterus in the A section on the left side, and then due to hypertrophy and hyperplasia, the size of the uterus has increased a lot. That is seen on the right side. Similarly, under the microscope, the cells they normally are seen as in section B, but when they become hypertrophic, they appear like that we see in the uh, section C of this slide. Now, as I said, that the difference between hypertrophy and hyperplasia is that in hypertrophy there is increase in cell size, while in hyperplasia there is increase in the number of cells. And in the same way, hyperplasia can also be physiologic or it may be pathologic. So examples of the physiologic hyperplasia is the breast hyperplasia that occurs due to hormones, estrogens during pregnancy, and that is a preparation of the breast for the production of milk during the breastfeeding for the newborn baby. Similarly, the liver hepatocytes, they have got a greater tendency to undergo hyperplasia, and this provides us uh, a chance that we can during liver transplantations we can remove a substantial part of the liver, and with the hopes that since it can undergo compensatory hyperplasia, so after a few months the last part of the uterus is anatomically and physiologically replaced. The pathologic hyperplasia, it is also induced by hormones and growth factors. And as I said that the uterine hyperplasia that occurs during pregnancy and that we say is physiological. But if there is an interruption in the balance of the hormones, estrogen, progesterones, or gonadotropic hormones that are released from the anterior pituitary, follicular stimulating hormone, and luteinizing hormones. So there are certain pathological conditions in which the balance of these hormones is disturbed. And in this case, the endometrial hyperplasia or the uterine hyperplasia will not be physiologic, but it will be purely pathologic. Another example is that during the healing process of the wounds, the connective tissue that form the fibrous tissue and scar tissue, they also undergo hyperplasia. And in certain viral infections, pathologic hyperplasia occur. And one thing important that I want to discuss here, that pathologic hyperplasia provides a fertile field for the development of dysplasia, anaplasia, and neoplasia, that is the cancer. Now, coming to the atrophy, it is the shrinkage in the size of the cell by the loss of cell substance, leading to decrease collectively in the size of the organs. Now, when atrophy occurs, the common cause is when there is reduced functional demand. बेटा एक बंदे का जो है ना फीमर फ्रैक्चर हो गया और उसको पीओपी लग गया और वो 3 महीने बिल्कुल बेड में पड़ा हुआ है, तो वहां उसके मसल्स में जो नॉन मोबिलाइज्ड है, जो कि बिल्कुल रेस्टिंग कंडीशन में है, तो उस पर फंक्शनल डिमांड कम हो गया है। तो जब हम उसका पीओपी प्लास्टर ऑफ पेरिस रिमूव करते हैं तो हम देखते हैं कि उसका साइज डिक्रीज हो जाता है। सही ना? Sometimes the tissue doesn't get enough supply of oxygen and blood, and it will also lead to the decrease in the size of the tissue and organ. And the same is true about when the nutrition supply of a tissue is insufficient. And for the tissues and cells to remain live and active, they should receive the tropic signals in the form of various growth factors, hormones, and other stimuli which act as chemical messengers. But when the cells are deprived of these stimuli, or if these tropic signals they are interrupted, then the normal growth of the cells and tissue is retarded and the tissue will become atrophic. Another cause of atrophy is the persistent cell injury, when the cells undergo injury repeatedly, and the increased pressure on the tissue from the another tissue. For example, if there is a long standing tumor compressing the tissue, or due to any reason, but increased pressure on the tissue will lead the decrease in the size of the tissue, and the tissue will undergo atrophy. Certain chronic diseases, debilitating diseases, they also cause overall decrease in the health status of the person, and most of the tissues they become atrophic. Now, coming to the mechanism of atrophy, we should remember two things. Either there is decreased protein synthesis, or there is increased protein degradation. Alone or in combination, they will cause shrinkage in the cell size in the form of atrophy. So, there is a process in the body known as the ubiquitin proteasome pathway, in which certain proteins known as ubiquitin they bind to the cellular proteins, and this complex of the ubiquitin and cellular proteins is susceptible to be acted upon by the ubiquitin ligases, and the ubiquitin ligases which form the ubiquitins and cell protein complex renders it to the susceptible to the action of proteasomes and proteolytic enzymes, and the complex undergo increased protein breakdown and degradation. And the major stimulus for this type of atrophy and increased protein degradation and breakdown is the nutritional deficiency, or if the organ or tissue is not in use, if it is disused. Right? There is another condition which is known as autophagy, which is also known as the self-eating. When a cell doesn't get its nutritional supply, sometimes for to survive, the cells start eating its own organelles, and this is called autophagy, and this is a very short lived process because ultimately it will go to the cell death. In this slide you can see two pictures of the brain. The A is from the a healthy brain, and the B is for the atrophic brain, and this occurs mostly in old age, or brain becomes atrophic, and this is we can say is an aging process. Now, metaplasia. Metaplasia, it is also a type of adaptation, and it is sorry, it is a reversible change in which in which one differentiated adult cell type, which may be epithelial or mesenchymal, it is replaced by another cell type, and it may represent an adaptive substitution of the cells that are sensitive to stress by another cell types which are better able to withstand the adverse environment. As we discussed, the respiratory epithelium in smokers, and particularly heavy smokers, the normal columnar epithelium of the respiratory tract is replaced by the stratified squamous epithelium that will withstand the harsh environment better, but they are not so much beneficial as the columnar epithelium. And metaplasia doesn't always occur from columnar to squamous. In Barrett esophagus, in the disease, which is a disease in which the lower part of the esophagus that contains squamous epithelial cells, they are replaced by columnar epithelial cells. And this type of metaplasia, in which the gastric type of cells comes to lie in the esophagus, is also a risk factor for the adenocarcinoma of the esophagus. Now, coming to the summary, hypertrophy, it is increased cell and organ size, often in response to increased workload, and it is induced by growth factors produced in response to mechanical stress or other stimuli, and it will occur only in those tissues which are capable of cell divisions,